When you first start treatment with either octreotide or lanreotide, you will be talked through how it works and what you might expect to happen, including any potential side effects. As octreotide or lanreotide starts to be absorbed by the body, it can temporarily upset your usual gut hormone balance, and whether you already have symptoms or not, you may temporarily start to experience some gut symptoms, even if your net is not within the gut. Gut symptoms include nausea, tummy cramping and/or bloating, wind, diarrhea, steatorrhea and/or constipation. You may also experience dry facial and chest flushing and/or alterations in your blood sugar levels. Developing new symptoms like these, or having pre-existing symptoms worsen, even if temporary, can be alarming, but it is not uncommon. If you are going to experience symptoms, new or worsening, related to starting SSA treatment, they usually occur within 24 to 48 hours of your injection, but may happen any time within the first 10 to 14 days. If they do, they usually only last for 24 to 72 hours, and your specialist team will have advised you on simple steps you can take to manage these symptoms, such as simple pain relief. Many people, especially those with carcinoid syndrome, find that not only does this temporary reaction stop occurring after 2 to 3 injections, but the symptoms they had experienced before SSAs also start to improve. If you get to day 14 or beyond without experiencing a day or two of these symptoms, then they may not happen. Consequences of SSA treatment that may develop as side effects over time include altered blood sugar levels, feeling sick and/or reduced appetite. You may experience one of these symptoms or all three. They may be related to each other. While SSAs can suppress excess gut hormone secretion, they may also prevent the pancreas from carrying out its usual functions of producing normal levels of the hormones, insulin and glucagon, and pancreatic enzymes, even if the pancreas is clear of neuroendocrine cancer and disease is elsewhere. If the pancreas cannot produce enough enzymes that normally help with digestion, this can lead to pancreatic enzyme insufficiency. Pancreatic enzyme insufficiency may lead to malabsorption, raising the risk of vitamin and trace element deficiencies, particularly vitamins A, D, E, and K. Vitamin B deficiencies have also been reported. If insulin and glucagon levels are low, this can result in raised blood sugar levels, but with sudden lows. You may experience all of these symptoms alongside those that are similar to type 2 diabetes, but with hyperglycemia, low blood sugar, episodes, and possible PEI. This particular pattern of symptoms is sometimes referred to as type 3C, pancreatogenic or pancreatic exocrine diabetes. Tests may be required to check for this. Feeling sick may be related to the thought of having the injection or having to self-inject. Nausea can reduce your appetite, though sometimes eating, particularly little and often, or sipping a glucose drink can help alleviate both. Gallstones, gallbladder infection related to thickening and/or gritty bile. The function of the gallbladder as a hold and release vessel for bile flow can be affected by SSAs. This can lead to thickened bile, which in turn can cause grit or stones to form. As grit or stones pass through the bile duct system, they may cause irritation of the bile ducts and/or infection, cholangitis. Gallstones may cause pain, nausea, and if they block the bile duct, jaundice, yellowing of the skin and whites of the eyes. Gallstones and thickened bile may be treated by medication, ERCP and/or surgery. Altered bowel habit, diarrhea, steatorrhea and/or constipation. Steatorrhea is pale, smelly, oily diarrhea that doesn't flush away easily, tending to float in the toilet bowl. It is often associated with pancreatic enzyme insufficiency. Diarrhea and/or constipation may be related to altered hormone levels. Many of the gut hormones that may be suppressed by SSAs, including serotonin, are involved in supporting normal bowel function. If excess serotonin isn't completely controlled by SSAs, this can cause diarrhea. Feeling bloated, often associated with steatorrhea, wind and/or constipation. Flushing, bradycardia, slowed heart rate, headache and/or dizziness. Some of the substances and hormones that neuroendocrine tumour cells can release can affect the constriction and dilation of blood vessels. This can lead to increased or decreased blood flow and blood pressure, and/or alterations in heart rate. Careful monitor of the frequency and severity of symptoms is required to inform best care. Switching analogues may help. Reduced thyroid function. The thyroid gland can be affected in a similar way to the pancreas. Its ability to produce normal levels of thyroid hormone can be reduced. Tests can be undertaken to check for this. Soreness or a lump at the injection site. SSAs come with an information leaflet that gives advice on how they should be stored, prepared, and administered. Following these instructions can help prevent or reduce the risk of injection site problems.